My name is Dr. Hala Ahmed. I'm a physician here in Surrey-North Delta, and I am one of the physicians at the Roots Community Health Center, which is the new clinic for newcomers to BC. I'm also the executive director of the clinic.
My name is Majid Hussain. I'm one of the physicians in Surrey-North Delta and been working here since 2014. I'm also the chair and the co-director for Roots Community Health Center.
One of the really rewarding things for me is to spend a little bit more time with patients, listen to their concerns, and provide more education to them. This is the main things that most of the newcomers to Canada need. They need someone to listen and to address their concerns, and then to provide some health literacy education in terms of what services are available and how to access these services, and what is the best way to deal with medical issues when they're faced with here. There's a lot of anxiety when you leave your home country and go to another country. Add to that level if you are escaping a war zone or something, more traumatic like that. So a lot of rewarding really for me is to be there for them and to make them feel like they're at home and that there is someone that can listen and provide that level of care.
Experiences that I've had individually in these rooms with these patients is so unique. One thing that comes to mind is a patient that I had seen that just came to Canada 48 hours before I seen him, and he was sponsored here as a government-assisted refugee. There was a 26-year-old gentleman who came in, and he was on a wheelchair. He was wearing diapers. He had a catheter, and he really, had not had any healthcare services or seen a doctor in about 1.5 to 2 years, because his goal was just to be able to make it to Canada. When I looked into his eyes, I realized that he, in some ways, had just lost hope. And it wasn't hope in terms of him wanting to run again or walk again, because at 26, he knows that that would never be possible. But what I wanted to be able to is restore his hope in healthcare, restore his hope in safety, restore his hope in what medical services we as physicians have the duty to provide for these populations that have come, and we've opened our doors to them, so I think it really is our responsibility to be able to give back. So the Refugee Working Group was started back in December 2016. There was a huge number of refugees and new immigrants moving here to BC, specifically to Surrey, and there was a big crisis at that time, and that continues right now.
I think the fact that we just established ourselves as an entity that patients can look for, and we've been receiving referrals from public health, from different community organizations, especially when faced with a patient who has needs that cannot be fulfilled through a community provider.
My dream is basically to be able to expand Roots, but not compromise care. I think it's really important to be able to have our eyes on each patient as an individual, as a center of this community health center, and being able to propel and grow.
My dream is really to grow Roots Community Health Center to be one of the newcomers medical home in BC. So, provide all sorts of services to the newcomers, that it becomes the where to go for newcomers, and then establish actually satellite centers for Roots in other areas that newcomers might choose to settle. So it will continue to provide that across BC, and maybe one day across Canada, who knows.
So that would be a dream, to be able to use this model not only with the population that we have, but encourage more healthcare professionals to join, and to be able to provide this for other vulnerable populations as well.